Hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill and thank you so much for your time and tuning in to the following video where we will show you how we can combine crowns and veneers in a so-called full mouth reconstruction. That means a treatment where we re-establish the entire functionality and aesthetics of a patient's mouth. So thank you very much again for your time and we do hope that you enjoy the video. Thank you.
You can see here the initial situation of the patient, and it's not a bad of a smile, but she wants to improve the situation. If you go into the mouth, you can see old veneers being a little bit lighter than the residual tooth substance, and you can see also in the lower jaw loss of tooth structure because of decay, too acidic food and too heavy brushing. So the first step we always do is take an impression of the upper and lower jaw, take a bite, and let the technician have produce a so-called wax up. That means a visualization of the final situation. After that, we go into the mouth, because we know now how it should look like, and take the impression. Here you can see the preparation for the impression. With the teeth all nicely drilled for the crowns and the veneers, and the green stuff here is a cream which stops the bleeding. After the preparation, of course, the patient will receive a temporary solution. This temporary solution is not just there to cover the teeth, but also to test the aesthetics of our wax up, of our final situation. And at this stage, the patient can make every suggestion he or she wants to improve it. And then again, we'll take an impression of the temporary and give that to the dental technician, who then in turn can produce the final situation. And you can see here the final situation, which is equal to the temporary, with a small difference of slightly larger and longer front teeth, which the patient requested. These veneers are made out of pressable ceramic and then nicely polished and glazed. The life expectancy of such veneers are, with 86% chance, 20 years. And you can see here, going inside the mouth in the close-up, this is how the veneers, partial crowns, and in the very back the crowns look like. You can see nice soft tissue situation, no inflammation, and very nice smile. Thank you very much.